Okay, so the first question is, what is your most likely diagnosis? So on the basis of your history, on the basis of your physical examination, you are going to decide your diagnosis. So what is basically the history and physical examination? The history and physical examination should be so focused that you are not asking about every single thing, because in the 8 minutes you have to cover your history and you have to cover your physical examination. So be more prepared for the accurate things that you shouldn't be missing, because you are asking about unusual things. Like if you have to rule out cancer, let's suppose if an old man is coming with the anemia, your focus should be colon cancer. Instead of asking about everything else, you should be more prioritize your diagnosis, and you have to rule out all of your next diagnosis in your history and the physical examination. So you have to be prepared. What is your most likely diagnosis? Answer just right after your physical examination and your history. Like the next question, the first thing they're going to be asked, and you have to answer only one, because your history and physical examination should be good enough to make that one particular diagnosis to be said at that time. If it's a perforated peptic ulcer, if it's whatsoever it is, what is your diagnosis? It is going to be based on your history and physical examination. It will help you after that history and physical examination to write on only one answer. Then moving on to the next one, what is your differential diagnosis? Now, in this point, you have a scope of answering 2 or 3, but make sure you stay in the scope of the same answers. Like let's suppose you are talking about perforated peptic ulcer disease. You shouldn't be saying something very unusual. You can say about gastric ulcer, peptic ulcer, but it should be within the range of those differential diagnoses, and you can range up to 3. But your first diagnosis, whatever you are saying, should be the same or the main diagnosis what you come up from the history and physical examination. Like let's suppose I talked to a person and he was having smoking. All of the things, whatever I asked in history, is leading towards the COPD. So now your first thing, if they said, what is your differential diagnosis? So I'm going to say acute exacerbation of the COPD. And one more thing, when you're talking about the diagnosis, make sure you say the exact and accurate line, not just COPD, but you have to say chronic obstructive, pulmonary disease or disorder. And the same time, is it acute exacerbation or is it just a COPD? If the patient is coming in an emergency, he's having this, whatsoever condition and is exacerbated. So you have to say acute exacerbation of COPD. Just saying that COPD is not the enough answer. Same goes for CDM question. When you're writing your diagnosis, you have to make accurate diagnosis when you're writing down, not just COPD. You have to write down every single thing, just like how you are going to say in the NACOSCI, your diagnosis, even in the diagnosis, in differential diagnosis, you have to say the accurate one, like the full-fledged form, what happened, okay? Then the next one, what is the investigation you would like to do at this point? Make sure you hear all the question, what he is saying in the post-encounter question. Most of the time they said the investigation you do at this point. So you do at this point can cover all the basic, like CBC, differentials, then urine creatinine bun, all the electrolytes, whatsoever is needed at that point. So you can cover, and mainly this at this point will not cover the CT scan or MRI until proven, like, if somebody has a subarachnoid hemorrhage, then that is another point. Then you can start from CT or, those things. But usually you start from the basic things. You are not going to directly jump from X-rays, ultrasound. You at this point means, what are you going to do at this particular point means you have to take blood sample, urine sample, all of those things, which is not basically so invasive or cause the problem for the patient. So you have to write down all of those things, which is basically like CBC, differentials, BU, and creatinine. So you can take out all the names one by one. Okay. So at least you should be prioritized that this is going to help you to build the diagnosis. Now, moving on to the next one, the other thing they can ask is, what is the definitive diagnosis? What is the definitive investigation you would like to do? Investigation you would like to do to confirm your diagnosis. So in this point, you are going to take only one name. If it's an X-ray, if it's an ultrasound, whatsoever, it's helping you to build the diagnosis. So make sure you know what they are saying. If they're saying you would like to do at this point, or they're asking you would like to confirm your diagnosis, those two are different things, and you can mix it up. So make sure you, before answering them, let them speak and ask your question, listen carefully what they're saying, and then say what you want to say. So it is basically confirm your diagnosis should be only one answer, like X-ray, CT scan, or whatsoever. Okay. So what is the treatment? Now talking about the treatment, the third question would be talking about the treatment. Now they said, what is your most appropriate treatment at this point? So now you are going to talk about just the treatment. Don't talk about like I would, put the patient here, put the patient there. That is something like, comes in the management. Treatment is something you have to give either IV antibiotics, if you have to do like, surgical laparotomy or whatsoever, consult a surgeon, or all of these things that is covered in the treatment. Basically that particular disease is going to how you are going to treat. So this treatment word will cover all of those basic treatment, not talking about anything else. Then if they ask about manage, then manage is basically going to cover your prevention and treatment. Like if somebody is coming, you have to talk about sleep hygiene, you have to talk about smoking, then you have to talk about their sleep diet, then exercise, smoking, alcohol, if they have been taking it. So you have to start from there, then add the treatment. This management includes both prevention and the treatment as well. Otherwise, if you just write on the treatment, it will not cover. Even if the patient is going home, then you have to counseling as well. So this will cover all of the 3 points. Okay, so this management will cover prevention, treatment, and counseling as well. So it applies into the CDM questions and it applies at the NAC-OSCE questions. So C, the treatment is different, but the management will include prevention, treatment, and counseling, all of the 3 parts. If you missed one of them, you will not score all the points, okay? They have a key and they will check if the patient, the person didn't answer these questions. So then one of the things they will ask is read the X-ray, ECG, or ultrasound. Now what will happen here? If you said, what is the definitive diagnosis you would like to do, you confirm your diagnosis. Let's suppose I said X-ray and the answer is ultrasound. They will give you ultrasound. They're not going to say yes or no or wrong or whatsoever. They are not going to say anything. Now they said, give you ultrasound. Now they said, can you interpret this ultrasound? What are you going to do? You have to explain the normal changes, the normal things, like trachea is midline, the lungs are there, there is no opacity or there is no nothing whatsoever, there's ribs present, neck is in the symmetrical, like everything, like there is no, heart is in the middle, all of those things. I'm just giving you a rough idea. Then at the same time, you are going to tell all the things which is making your diagnosis. If there is an opacity or there is a pleural effusion or there is dense mass or whatsoever in the right side of the lung, which is going along with my diagnosis of COPD. So this is how you are going to interpret either X-ray, either ECG, either ultrasound. So they are going to give you right after this diagnosis investigation. So the first question could be, what is your definitive investigation you would do? Then they will give you ultrasound or ECG or whatsoever. And then they ask you, what is your diagnosis? This could be the third answer question as well. Now, on the basis of ultrasound or ECG or X-ray, you have to tell. Sometimes they can give you ECG and ask you what is the abnormal finding you are looking at. Then if you start from the normal finding, then you are just wasting your time because they ask for the abnormal one and you are telling the normal one. So make sure you listen to every single word what they are saying. You have to answer according to the question what they are saying. If you keep on saying something which is not relevant or which is not in the question, then you are just wasting your time. You're not going to score a high marks because of, you were so over efficient and you were trying to, cover all the points. This is not how it works. You have to be very accurate. What they are saying, you have to answer those questions, because if you are wasting time, then it means, let's suppose if you, there was only 3 minutes to answer these post and counter question. If you answer the first question, you are wasting time on second question and you miss third question because of there is no time and you have move on to the next station. Then the third post encounter question would be marked as 0 because you didn't come across, he didn't ask you and you didn't answer it, so you will get no marks. That's why you have to be very accurate and move on to the next question. So moving on is also one of the point. And one of the thing, if you, let's suppose if they ask for the investigation and you are not sure what you are going to do, so don't bluff. Don't say which is wrong, or don't say that's going to harm the patient. Let's suppose you are going to directly jump to CT scan and that person is going to get damage from the CT scan. So just don't directly jump to something like that, especially when you say ABGs, because ABGs are very painful procedures. So you don't directly jump to start with ABGs until the patient is having acute exacerbation or where the ABGs are needed. So see what you are saying, because on the basis what you are saying will affect your marks. Okay. Then summarize your history. One of the points they can ask you, summarize your history. So you have to cover all the points what you find in this patient, the patient is 29-year-old, he came in the OPD, he was having this, he was having that, and now he's having this, now he's having that, and all of those points. So I asked this is normal, this is also, you have to cover all the normal points together, all the abnormal points together. So in my general opinion about this is, when you are taking a history, make sure you when you are outside preparing for your inside station, write down outside O, P, Q, R, S, T, whatsoever, mnemonic. So write it down. And when you come inside, just write down positive, negative, tick or cross in front of it. So it is very easy for you when you are summarizing. You can look at it, what was there, what was not there. So it will help you like that. Okay. Don't just keep on looking at the paper. Make sure your eye contact with the patient is very important, because you are like, talking to the patient and you are looking down. So it will not, give a good idea. Then prepare well, practice a lot. Physical examination, please work on it. It's very, very important. So do a lot of preparation when you are preparing with your partner. And it is very, very important. And just when you are preparing for CDM question, just think the same. Kind of the same questions is asked, but just make sure what the words are asked. Then on the basis of that, you have to answer. Mostly post encounter questions are very, very easy, and we just mix it up. So it's very important. That's about it. This is all about post encounter question. If you still have any question, you can ask me. Any question?